Hi, my name is Thida and I'm one of the speech pathologists here on the team at CUI Speech Pathology and Occupational Therapy. And I thought I'd spend a bit of time talking about a question that myself and a lot of the other speech pathologists on the team seem to get from our families at multiple points in their therapy journey. And that question is, what does a speech pathologist actually do? And how can you help my child with those aspects? And so overall, a speech pathologist is a specialist who works in the domains of communication and the physical aspects of feeding and swallowing. And we support all people from birth all the way through to the end of life with all of these aspects. And across these aspects, we will help you to diagnose difficulties, identify what points are strengths, what are weaknesses, and will support you with intervention or additional supports and strategies to overcome or to strengthen these difficulties. And the aspects of communication we do work on include language, so being able to convey your messages and your thoughts and ideas, as well as to be able to understand what people are saying to you. We also work with being able to speak in a clear and fluent manner, so you're using an appropriate voice so that you can be understood and heard by others. You are speaking without stuttering, and you are clearly articulating and pronouncing your sounds. We also work in the domains of reading and writing. So that involves being able to sound out what you're reading, as well as to understand what you're reading. This then, on the flip side, transfers over into being able to write messages clearly and to be able to spell appropriately. Alongside this, we'll also support individuals who have complex needs across multiple aspects of communication and do require some alternative means of speaking because their verbal speech is not functional enough for them. So that is what we work in as a speech pathologist. Here at the CUI Speech Pathology Clinic, we are a pediatric-based service, which means we focus primarily on all the developmental aspects of communication and supporting families through this. So a lot of our caseload involves children from about 18 months of age all the way through to late adolescence, but we do also support young adults who have a diagnosis, disability, or significant impairment that does mean they still need a bit of support with these early developmental communication, reading and writing skills. And so here at the clinic, if you were to come in with your child, what we would do first of all is provide assessment, and that would help you to understand your child's communication profile, going through all aspects of the difficulties you're concerned with. So this involves being able to understand what's happening for your child under the surface and what weaknesses are presenting and what these look like for your child's communication. And we'll also help you to understand the child's strengths, what they can do really well, and how we can use these to the child's advantage to overcome these weaknesses. And understanding your child's current communication profile, if applicable, will help you to identify a diagnosis for the communication difficulty, and will also help you to understand what that means, what the therapy journey looks like, what interventions are required and what their intervention basis is, as well as potential alternative difficulties and other aspects of communication your child might come across throughout their lifespan as they continue to develop in all of their aspects of communication. And so that gives you a really nice clear picture of what you're looking at with your child. Then from there, we move into interventional support, and this can look like however you would want it. So for a lot of our families, they prefer collaboration, so coming to regular therapy sessions where we provide intervention, provide you with strategies that you can give to the child's educational staff and that you can implement at home, as well as home follow-up tasks that will continue to support your child's skills in between therapy sessions. Some of our parents also opt for home programming and parent coaching, so that's where we provide you with additional education and resources to use in the home environment to support your child further at home. So if you're concerned with any of these aspects with your child, or you'd like to speak a bit more about what potentially might be happening for your child and whether there are any aspects of their communication we can help with, please don't hesitate to get in touch with the clinic and speak to one of our lovely receptionists who will be able to put you forward to a speech pathologist. I hope this has helped you all. Have a lovely day.